process because almost everybody has to appeal. They deny everybody. So it's a very common thing. And I'm going to give you guys some resources and tools so that if you decide you'd like to take this journey and you need some help along the way, you know where the tools are. So I'm going to go ahead and get started and share my screen. And as Katie said, that acronym list is probably a great thing to have handy while we're going through this, because there are a lot of acronyms. I will try to explain them as we go along, but it's just nice to have that tool as we're going through this. So let's get started. And the first thing we're going to talk about is Social Security disability insurance. So there are really kind of two broad categories of Social Security benefits for people with disabilities. There's insurance benefits, where somebody's done something to earn this benefit. And then there's needs-based benefits. So we're going to talk about them kind of in those big pictures. And this benefit, Social Security disability insurance, is one of these insurance benefits. Somebody's done something to earn this one. So with Social Security disability insurance, the person getting the benefit has actually worked and paid enough into the system in FICA taxes to be eligible for benefits. And it's wonderful because Social Security actually has rules that makes it easier for younger people to get benefits with shorter time requirements and a shorter number of credits. And then as you get older, they increase the amount of work you have to have done to get benefits. The benefit amount you get actually depends on how much you worked and paid into the system. And you can get dependent benefits because this is an insurance benefit. Your dependent children can actually get benefits off your record, which is really nice for families because you still have to support your children. Because it's an insurance benefit, we're on the insurance side of the house, there's no resource limit. And that means that you could own a mansion and a yacht and you could still get Social Security disability insurance if you qualify. So you don't have to worry about how much you have in the bank or whether you own real estate. You're automatically not going to be eligible without worrying about those resources. One of the things I want to kind of give you guys a heads up about this benefit is, first of all, they can go retroactive up to 12 months, which is nice. It gives you kind of a window to apply. Sometimes if somebody's decompensated and they're in the hospital and they're not able to work, their first thought isn't, oh, I think I'm going to apply for Social Security today. They need a little time to do that. But with this insurance benefit, there is a 5-month waiting period from when you have the disability onset to when you can actually start getting payments. And there's a health program that comes with this called Medicare. You've probably heard of it, but there's a 24-month waiting period before you become Medicare eligible. So I want to give you guys some really practical tips regarding this. So when my son went to apply, he was 21, but he'd been working pretty continuously since he was 15. So he had actually paid enough in FICA taxes that he was eligible for this insurance benefit, Social Security Disability Insurance, or SSDI. So he got sick and really had to stop working in September of 2019. It was like the second day of the month. He couldn't work anymore. So it was a while before he decided to go ahead and apply. In January of 2020, so months later, he went ahead and applied for Social Security disability. And in February, they had his interview. So he actually went into the office because we were pre-pandemic. He went into the office and he applied for his Social Security disability, did the application process in person. And then they took a while. And in June of 2020, they said, we don't think you're actually disabled. Even though he'd been in and out of the hospital, we had tons of medical records. They said, we don't think so. So he filed an appeal. And in February of 2021, this year, they actually found him eligible. So they paid him back to 5 months after he was first eligible. So remember, he stopped working in September. So he couldn't get paid for September, October, November, December, or January, but they could start paying him in February of 2020. So we got a year's worth of benefits back. So they paid him back for that entire year's worth of benefits, which was some good money. And then he started getting a monthly check. So around the middle of every month, he gets a check from Social Security on an amount based on how much he worked. And this has been transformative for him. It really has. He was very much trying hard to be independent. He was trying to work full-time, which was not working for him. He had to go back to part-time. Every time he tried to go to full-time, he would decompensate. He would end up in the hospital. He would have to go through partial hospitalization. And then he would get done with that. He'd have to go back to work and start back at part-time. And the thing that was hard for him is, he would miss a month to 6 weeks of work every time this happened. And it was happening 2 to 3 times a year. So it was frequent for him. And during that time, he was having to ask for help from me, from his girlfriend, from her family to cover his rent and to pay for his expenses because he had no income during the time periods when he couldn't work. So what Social Security disability has allowed him to do is decide to work part-time because he knows he can do that. He knows he's successful. He knows he does better when he has somewhere to be. He has a routine and a structure to his day. He has purpose. And so working part-time is really important for him, but he can combine what he gets working part-time and what he gets from Social Security disability insurance. He's actually making more than he was working full-time. So it's huge. But he also knows that if something happens and he ends up in the hospital, he has enough money from Social Security to pay his rent, to pay his utilities, to pay those essential living expenses and not have to worry about it. So this has been a really big deal for my family. And it's part of why I wanted to do this series, because I know a lot of families are trying to figure out this financial piece. So I'm going to talk about the next program. And this is called Childhood Disability Benefit. And again, this is the insurance side of the house. Only in this case, it's not the person who's getting the benefit who's worked and paid into the system. It is their parent who has worked and paid into the system. The name is terrible because in order to get childhood disability benefits, you actually have to be an adult. So you have to be age 18 or older, and you have to have a disability that started before age 22. And you have a parent who's either deceased, retired, or disabled. And that allows you to get a benefit off that parent's earnings record. And sometimes it can be a lot higher than what the individual would get on their own earnings record. In fact, you might have somebody who has no earnings record of their own, but they can still get this benefit off of a parent. Again, there's no resource limit because we're in the insurance side of the house, so they don't have to worry about that. People on CDB are eligible for Medicare, just like people on Social Security disability are. So for example, in our case, I know that when I retire, my son will be eligible for this benefit off of my earnings record. And if something happened and I became disabled before my retirement age, he would be able to get this benefit off my earnings record. And heaven forbid something happened and I pass, I know that he would be financially stable because he would have this benefit. So this is a really great benefit. And the reason I'm mentioning it today is because if you look at the age of onset for a lot of mental health conditions, late teens, early 20s, there are a lot of people with mental health diagnoses who are actually eligible for this benefit. So it's really common. I'm going to pause for a minute and see if there are any questions about either of these benefits before we move on to the needs-based side of the house. So if you have a question, feel free to type it into the chat box. I'm going to pause for a minute and ask Katie if we've got any questions.
We don't have anything in the chat box just yet.
We'll give folks a second. Still nothing?
Nothing.
All right, then I'm going to move on.
Great.
So the next benefit we're going to talk about is called Supplemental Security Income, or SSI, and this is a needs-based program. This is for people who have not worked and paid enough in, or don't have a family member they can draw off of who's worked and paid enough in. So it's for low-income people, and the maximum benefit this year is $794. Not a ton of money, but it usually comes with other benefits that kind of builds a package that people can live off of. So usually when people are on SSI, they're going to be eligible for what are called SNAP benefits or food stamps. They'll be eligible for subsidized housing, and they're going to be eligible for Medicaid to pay for their health care. So it's a nice package of things that help make it more livable, living on $794 a month. So unlike the insurance programs, this needs-based program has a resource limit. It's only $2,000 that you can have. This includes things like money in savings, includes not the home you live in. So if you own your own home and you live there, it's not going to count. But if you own property you don't live in, it could include that. You get to keep up one vehicle. So if you have one vehicle that you use to get to and from the doctor, to and from work, that's not going to count. But if you have additional vehicles, recreational vehicles, boats, ATVs, RVs, any of that, that's going to count. And so it's kind of hard for people on SSI to be able to save. It's the American dream, right? We save for the things that we want, the things that we need. We have a safety net, a little nest egg in case something happens, right? And it's hard on SSI because of this resource limit. In a minute, we'll talk about a strategy for dealing with that. Also, other income is going to reduce the benefit amount. So if you have income from another source, whether it's work or another unearned income source, or even if somebody else is just helping to pay your rent every month, that can reduce the amount of your SSI. So folks on SSI have to be really careful about their resources and about other sources of income. They have to report them to Social Security, and their benefit's going to be adjusted based on those things. So sometimes being on SSI can be challenging because the benefit amount goes up and down and up and down if people are having fluctuating income. There's no dependent benefits with this because it's not an insurance benefit. You didn't pay in to get it. They don't have any kind of a dependent benefit for folks on SSI. Here in Ohio, if you're on SSI, you automatically get Medicaid coverage. This is not true in every state. For example, if you're joining us today from Indiana, you don't automatically get Medicaid with SSI. And one thing I want to tell you guys about Medicaid. Medicaid is a word we use to describe about 50 different health coverage programs. So for example, my son's still in his 24-month waiting period for his Medicare coverage. Remember I said they found that he was eligible in February of 2020. That means February of 2022, which is a little over 6 months away, he will be eligible for Medicare. But in the meantime, he is on Medicaid. So there's categories of Medicaid for people who are low income. There are specialized categories of Medicaid for people with disabilities, including a category especially for people with mental health diagnoses. And there's Medicaid for people who are working. So there are lots of different options for Medicaid. We'll talk about those in the session where we get into more detail about what happens when you go to work. But I just wanted to let you guys know there's different types of Medicaid coverage out there. So we talked about that $2,000 resource limit and how hard that can be for some folks. So I want to let you know about this great tool called a stable account. They're actually called ABLE accounts in other states, but in Ohio, we added the state basis, so we made it stable accounts. I've given you guys the website here so that you could go apply. And I have to say, setting these accounts up online is really fast and easy. My son did it himself. I was in the other room cooking while he was in the dining room. I answered a couple questions for him, but it only took him about a half an hour to set up an account. So you set up an account, you have to make a $50 deposit for the account to be opened. You can set it up to be like checking or savings or investment options. And you even have different investment options like, if you're higher risk, lower risk, medium risk, you have different tools that you can use. These accounts do have fees associated with them. It really depends on the investment tools that you choose for your account. But as more and more people are joining Ohio's stable accounts, those fees are actually going down because it's divided over the entire pool of participants. So if you go to the website, they have details as you set up your account on what your fees would be. They're not high. In the world of brokerage accounts, they are really, really affordable. So these accounts can be self-funded, meaning that my son can put money in his own stable account if he'd like to. It can also take contributions. So if I want to give him money for something, I could put it into the stable account, and then that money would be available for him to use. You can put up to $15,000 a year from any source into your stable account. And if you're working, you can put an additional $12,760 a year from your wages. That amount goes up a little bit each year, but those are the 2021 amounts. The current lifetime max to have in a stable account is just over $500,000. So that's a pretty amazing savings account, much better than the $2,000 resource limit. One thing I want to let you know is what this does. It protects resources. It does not protect income. So if somebody were on SSI and they put their entire paycheck every month into it, that paycheck is still going to count as income and affect the amount of their SSI check, but they're not going to go over the resource limit if they're saving money in the stable account. So the next month when it would be looked at as a resource, if it's still sitting there, it's not going to count. Up to $100,000 in a stable account doesn't count. So $2,000 or $100,000, I don't know about you, but I'd rather be able to save more. So this is a great tool. Also, if you've ever dealt with special needs trusts, which were in the past, how people on SSI and other needs-based programs were able to save money, it's much easier to use the money in a stable account. It can be used on anything that's called a qualifying disability expense. But this includes things like rent, medical expenses, vocational rehabilitation and education, transportation, legal fees. It's a very, very broad category. I have not had a client ever tell me that they had something that was found to not be a qualifying disability expense. So it's a very broad definition. Pretty much any expense for a person with a disability is found to qualify. So I want to pause now and give you guys a chance to put questions in the chat box about either SSI or stable accounts. So I'll give you guys a second. Okay.
The first question was, SSI is for those who haven't paid enough into FICA taxes, correct?
That is correct.
Okay. And then the next question was, can you have a stable account if you are on Medicaid?
Absolutely. And 100% of what's in your stable account does not count as a resource for Medicaid. That's a great question.
Okay. All right. And then we also have a question. Can you go over CDB again? And then will we be able to get printed information that you went over today? You will receive I can answer that second part. You will receive a post-event email that has the resources as well as the acronym sheet that you already have. We will send that to you in your email as well.
So question was about what is childhood disability benefits again. So we're going to back up. We're going to go back into the insurance side of the house. Childhood disability benefits is for individuals age 18 or older who have a disability that started before they were 22. So it doesn't matter when they apply. Maybe somebody's applying at 30, but the first time they were hospitalized for schizophrenia, they were 17. That disability started before they were 22 and they're over the age of 18. They can get childhood disability benefits off of a parent's earnings record. So the parent worked and paid enough in FICA taxes for their adult child to be able to get this benefit. And one of three things has to happen with the parent before the child can access it. In other words, the parent's account has to be opened first. And the way the parent's account is opened is if the parent dies, becomes disabled, or retires. If that did not answer your question, go ahead and put in the chat box if you want to know more. What else do we have, Katie?
That's the only thing in right now. And I just want to add also, if anyone has any questions and you're more comfortable just unmuting yourself and asking, you can of course feel free to do that. Just type them in during if you have any questions while Deborah is presenting.
All right. Any questions before? Yeah.
Deborah, I'm filling out the annual report and it gives us space for the doctor's appointments in the past 2 years from 2019. Do I put every single doctor appointment in? There are 3 lines. And then beyond that, there's a number 6 where there are 3 more lines where you can fill in, but that's certainly not enough for all of the doctor appointments.
So I'm assuming you already have someone in your life who is on Social Security benefits and you're doing the representative payee report, correct?
Correct. That's correct. Yes. Well said.
So as a representative payee, you actually manage the finances for someone who's been found in, to have challenges with managing their own money for Social Security. So
Correct.
they pay the money to a representative payee. So what I would do if I only had 3 lines, my son fortunately has seen the same psychiatrist, same therapist, and gone to the same hospital for years. So I would put each one on those lines, and I would put the dates of visits being, rolling back 2 years, I would say, yeah, from June of 2019 to June of 2021, this person's been their therapist.
Okay, so it would just be if for the disability
Yes, it would be
problem, it
related.
wouldn't be for like any kind of doctor, like going to the doctor because you hurt your foot or something like that.
My son was in a car accident recently. I don't think I
Okay.
waste my time putting anything about that emergency room visit. It was unrelated to his disability. What they're really checking is to see if the person is still getting their medical care.
Okay.
Yeah.
Yeah,
So,
not good just going in for a physical, but actually going into a psychiatrist for an evaluation or for assistance.
yeah.
Hey,
Okay.
Deborah, yeah.
Thank
You
you.
mentioned, yeah, Deborah, you mentioned an automobile accident. My daughter had one and it's pending, all right? And so it's not clear what she may receive from it. And so the settlement offers have been very small, like 12 grand or something like that. But the attorney thinks it's more, depending on what a doctor says. But let's assuming that, you mentioned $100,000. If you got $100,000, could you put that into a stable account?
Well, the challenge is, remember, there are those annual caps. So you can put up to $15,000 a year. So if a settlement was that large, I would actually talk, I can't give you legal advice, but you can talk to your attorney about setting up a trust that would not count for benefit purposes.
No, is that a special needs trust?
In a lot of situations, it would be a special needs trust. It really depends on the benefits that your person's receiving. And I really don't want to get into the nitty gritty. I don't want people to have to share their personal information. So
I don't care.
talk to the attorney about, the best way to set it up and make sure they know all the benefits that your loved one receives so that they set it up the correct way. Okay.
Now, getting back to the beginning, I couldn't type fast enough. When you were talking about the first benefit versus the insurance versus the disability. Okay.
Insurance versus needs-based programs. Yeah.
I'm not sure what my daughter has. I know she's got, she's qualified for disability, but I'm not sure whether it's A or whether it's B. And how do I know that? Go ahead.
One quick way to find out is to ask how much it is. So if it's $794 a month, that's SSI amount. And so that's pretty much a given. That's what they're getting. If it's a higher amount, it's usually going to be an insurance benefit that they're getting off their own record or off the record of a loved one.
Well, if she qualifies for Medicare, does that mean that she's on
She's in the insurance side of the house. Yes.
the insurance side of the house?
Mhm.
Right, so that would.
Medicaid is the SSI side. Medicare is the insurance side.
All right, and so that only relates to the health insurance though, correct?
Correct.
All right, and then in the interim, I think she was on Medicaid for a while.
Yeah.
And
My
then,
son's on Medicaid right now while he's waiting for Medicare eligibility. Yes,
okay,
it's very
but
common.
if you're on Medicare, then it's under the other one.
You have to be on the insurance side of the house, either getting Social Security disability or childhood disability benefits to get the Medicare. Yeah.
So she had enough on her own to get it, but is it better if she would have applied under my account?
You can certainly, if you are retired or disabled and you're getting your own benefit, then you could certainly ask Social Security. They're supposed to, when you apply, look at which amount's higher and give you the higher benefit amount. But sometimes they're not aware that you have a parent who's disabled or retired, so they may not have looked.
Well, I am now retired, but at the time that it was approved, I was not retired, but I am now in the retired category.
That is a question that you can absolutely look up in your My Social Security account. You can see how much your dependent benefit amount is, and then can talk to your daughter about how much she's getting, and you can see which one's higher. Or you can call Social Security. They can let you guys know too.
You're never going to get through to them. What's the place that you check now, please?
It's a My Social Security account. It's an account you go online to ssa.gov, which is Social Security's website. You can click on creating your own My Social Security account. You know, they used to mail out those statements you got every year that
Yeah, I
had
remember that, yeah.
what would happen if you retired, what happened if you become disabled. You can now get those online through your account.
But it's your understanding that you can shift from A to B though. I mean, if she,
Absolutely.
okay, all right, thank you.
And you can shift back. So let's say your daughter recovers from the car accident, starts working again and makes even more money, and now would get more money on her own record. She can go back. You can go back and forth between the two. Okay.
We do have a couple other questions in the chat
Yeah,
now.
yeah.
Okay.
Here, let me finish up on that one, but with regard to the,
I'm so sorry. We'll save time for questions at the end, but I want to get to everybody and make sure I also get through the presentation. So if you could hold on for just a minute, that would be great. Katie, what do we have?
Let's see, we have one from Susan that says, what if the mental illness started before 22, but was not diagnosed?
Happens all the time, but you can submit evidence. And so I've won those cases by submitting evidence from like school records, if there were like behavioral issues or some like grades fell really dramatically or something like that. You can also submit any medical records that you may have had. So maybe they weren't found disabled. Like I said, let's say the person doesn't apply until they're older because they're able to work when they turn 22. They're working, they're doing fine, they're doing okay. And then they decompensate, they're not doing well, they want to apply for disability at that point. They may have records from before they turn 22, whether it's school records or medical records, or even employment records showing they were struggling. They can submit that evidence.
Okay.
One more, Katie, and then I got to get going.
Sure. So the next one was, how is the breakdown for a disabled child and husband drawing Social Security /retirement?
Not sure I understand that question.
Okay, Janet, if you can kind of reword that and type it in, we will address that one in the next break.
Great. Thanks, Katie.
All
I
right.
really appreciate it. All right. So I just wanted to show you guys, there's a link in the slides. It takes you to this site and it's really easy. If you click on the enroll now, that's how you set up your account for a stable account. So Social Security has their own definition of disability. It's different in every system. I get people all the time who say to me, but workers' compensation found me disabled. Why not Social Security? It's because they have different definitions. So this is the one Social Security uses. You have to be unable to work and earn a threshold amount, which we'll talk a lot about in the next session, because of a medical condition that is expected to last or has lasted at least 12 months or is expected to result in death. So let's say I fell today and I broke my arm. My orthopedist said I need to have surgery. I'm going to be out of work for 4 weeks after surgery. That's not enough for Social Security disability. I'm only going to be out of work for a little over a month. It's not going to last at least 12 months or result in death. So that wouldn't be severe enough. It's got to really be a severe condition to meet their definition. So I've given you guys here a link to what are called the mental health listings. It's section 12.00 of the rules. This is sometimes called the Blue Book. So all the rules about disability for Social Security are called the Blue Book. You click on this link, it's going to take you to the rules for mental health conditions. And it actually goes through condition by condition. So anxiety disorders, mood disorders, organic brain disorders, autism spectrum disorders. It breaks them down condition by condition. And under each of those, you have to have the specific symptoms for that diagnosis. It very closely parallels the Diagnostics and Statistics Manual, which is what mental health providers use for diagnoses. So these symptoms will include things like a loss of interest in everyday activities, or suicidal thoughts, repetitive behaviors, paranoia, hallucinations. So it goes through different symptoms for each condition, and you have to have a certain number of the symptoms in order to be eligible, just like you would have to have a certain number of the symptoms to have the diagnosis in the first place. And then you have to have one of two things. After you've met the symptoms requirement, you have to have one of two things. You either have to have trouble with some very specific areas of functioning that I'll talk about in a second, or you have to still have severe symptoms after being in treatment for at least 2 years. So I'm going to break that down for you guys. So the things you have to have trouble with, and these have to be like marked or severe limitations, are things like getting along with other people. And remember, Social Security's definition, they're always looking for adults at your ability to work. And so they're looking at things like, could you get along with coworkers? What about customers, supervisors, or managers? Can you interact with these people? Or do you have limitations in your ability to do that? Are you able to remember and use information? So if somebody gives you, I need you to do these 5 tasks today, are you able to remember those 5 tasks and get everything done? Are you going to have to go back and ask for more guidance? Are you able to stay on task? So if somebody says, I need you to do these tasks, are you able to persist and concentrate long enough to get those tasks done? Or are you going to get distracted or be unable to follow the instructions? And the last one is adapting to change. And this includes things like regulating your mood, includes things like knowing socially appropriate behaviors. And I'll give you guys an example of this one because one time my son started actually rapid cycling at work. So he was actually at work, he was working in a warehouse setting, he was on the floor of the warehouse, and he was 1 minute screaming and yelling and enraged, and the next minute he was sobbing. He was rapid cycling at work. That shows that he was really struggling to adapt that day. He could not self-regulate. It was a challenging day for him. So that's the trouble with. So you either have to have that trouble with, or you get some people who, you know, they've done everything. They've been taking their medications, they're going to therapy, and they may not have these specific categories that they struggle with, but they're still really having severe symptoms, maybe hallucinations, maybe paranoia, even though they're in treatment and doing what they're supposed to do. So that's the listing. Do you guys have any questions about the definition of disability or the mental health listings? And I don't want to answer your specific questions about your specific situation. That's going to get us bogged down. But if you didn't understand something I said, let me know. I want to clarify that for you. So Katie, do we have any questions in the chat box?
We do have questions. I don't know that we have any about that specifically.
Okay, then we'll save them for later if that's okay.
Sure.
All right, thank you, Katie. All right. So I want to talk about the application process now so that you guys have that information and know how to do it. And you absolutely, you are the loved one of somebody living with a mental health diagnosis. Not only can you help them with the application, but you should, especially if they're to the point where they're struggling with working, they aren't feeling well. It is a challenging process. It's complicated. And frankly, I always feel like they're just trying to make it so hard that people with mental health diagnoses give up. It's just really hard to do. So you can apply online. I highly recommend that. Local Social Security offices are still closed due to the pandemic. What that means is you can call and talk to them on the phone. You can schedule appointments to go in for very limited things, and they control whether or not you're allowed to do that. But you can't just drive up and get out of your car and go open the door. It's locked, trust me. I get people calling me all the time going, the door is locked. Yeah, it's still locked. Federal agencies have to have a plan by July 19th for when they're going to reopen, but that doesn't mean they're reopening on July 19th. It just means they have to have a plan by that date. So I've given you guys the toll-free number here, and in the resources, I've given you a tool to figure out which office is yours. So you can actually call your local office, which sometimes is faster. So I'll get you that information when we go over resources. And I've given you guys useful information to have when you're doing the application. You need to be able to prove identity, either citizenship or immigration status, proof of age. Medical records are the key to everything, and employment records can be very, very helpful. So I helped my son to apply online. I had him with me while I did it because I wanted to ask him the questions and have him feel empowered and like he was a part of that process. I did all the typing and helped him to clarify his answers to make sure that they were readily understandable by Social Security. Just so you know, you can start that application and stop and save your work. They'll give you a confirmation number to get back into your application if you need to. Make sure that you either take a screenshot of that page or you write down that confirmation number, or else you have to start back at the beginning. So keep your confirmation number. For my son, the key was really getting all those medical records together and getting them in. Remember, I said he'd been hospitalized a lot, so we had lots of good records, and also employment records. So I actually got a statement from his supervisor about the date he was rapid cycling on the warehouse floor, because that really showed what are his challenges when he's trying to work full time, and why is this maybe somebody whose mental health condition is really impacting their ability to work. So here, if you click on the link in that slide, it takes you to this page and you see there's a big blue button that says apply for disability. So that's how you're going to do it. It's right at this website. So then I want to talk about the disability determination process. So decisions are actually not made by Social Security. Who knew? They're made by a state agency called Disability Determination Division. It's part of OOD, or Opportunities for Ohioans with Disabilities. They are a state agency. You may be familiar with them if you've gotten vocational services through BVR, the Bureau of Vocational Rehabilitation. So same agency, different division. They will look at all the medical records you submit. They will request medical records, but I will tell you, they will request them. They will send one follow-up, and if they don't get them, they will make a decision without your medical records. So it's really important to submit the records yourself. Anything you think is important, make sure they have it. So that they have the records. I never count on them getting them because they don't persist the way we do when it's our own case or the case of our loved one. They might schedule, and they frequently will schedule, what's called a consultative examination, or a CE, which is a one-time examination with a mental health professional, usually a psychologist, paid for by Social Security. These are terrible. I'm going to just tell you right now, I'm going to be honest, they're often very short appointments. They're like a half an hour. I mean, my son's been in mental health treatment since kindergarten, and his appointment was 1.5 hours. How do you get like 15 years worth of medical information in half an hour? They just are very quick, very rapid. They're not very thorough. But here's the important thing. They have a rule at Social Security that says they have to give greater weight to a treating physician because they recognize that that relationship is more long-term, more comprehensive, and probably more accurate about what's going on with the person. So submitting those medical records with your application and then updating them periodically is really important. So I submitted records with my son's initial application, and then when we appealed, I gave them more medical records. So I just kept updating them. Also, your doctor can provide really helpful information. My son's therapist actually did an opinion for me, talking about how his work had impacted his mental health and how his mental health had impacted his work over the time that they'd been together, which was a few years, was the key, honestly, to winning the case. So getting your own provider to help is really, really important. And like I said, records from past employers can also help. Like I said, we did a statement from the supervisor who was on the day that he rapid cycled and just talked about how disruptive it was and how that's why he lost his job at that point. So I mentioned this before, almost everyone's going to have to appeal. That's just the reality. Everybody has to appeal. You can do the appeals online also. If you'd rather do it by calling them, you can certainly do that. You can also go into the offices when they're open again, but right now I recommend doing it online. It's the best way to do it. There are several stages to the appeal, but the good news is if you do it online, it will take you to the right paperwork for your stage. Or if you look at the decision you got, it will actually have detailed information at the end, the last few pages. We'll talk about the appeals process. For almost every stage of this appeal process, you have 60 days to file that appeal. Please note that 60 days from when you get the notice. They assume it takes 5 days to get it in the mail. I don't know about you guys, but our mail service has been much slower than that. So I date stamp the stuff as it comes in, and then I have proof that that's the date we received it, and we have 60 days from that date. At this point, if you're going to appeal, it's really helpful to have an attorney. And so at the resource page, I've given you guys information about attorneys and how to find attorneys to help with this. The nice thing is most attorneys who do this work, you don't charge anything up front. There's no cost up front to helping with an appeal. they take a percentage of the back award and it's capped at 20%. So that's all they can take from the person. And there's also a cap of $6,000. So if the person gets enough money that, you know, if they get over $30,000, the 6,000 is all the attorney can get. So that's how it works, but it doesn't cost anything out of pocket up front. I also think because the attorney only gets a fee if you win, it's huge motivation to the attorney to help you actually win that case. So if you click on that link for the appeals process, it takes you to this page. If you scroll down on this page, there's another blue box that says appeal, just like the one we saw that said apply. So that's what that page looks like. So I'm going to stop before we go over resources and see if there are any questions about applying or appealing. Katie, do we have any questions?
We have some questions in the chat box. Someone asked if we can send a link for applying for Medicaid and go over the process of applying for Medicaid.
So you apply for Medicaid with the Job and Family Services office. And I can, so it's ohio.benefits.gov is the website. Let me check on my phone. I'm sorry, I don't normally get on my phone while I'm presenting, but I want to make sure I gave that to you right. They change it periodically, and I want to make sure that's still what it is. So ohio.benefits, plural.gov. Aha, not their site. Hold on. I'm remembering it wrong. Hold on. Had it reversed, benefits.ohio.gov. If you go there, there'll be a click to apply, and you can apply for Medicaid using that. So again, it's benefits.ohio.gov. Can I ask you, Katie, to type in benefits.ohio.gov for everybody? Thank you, Katie. What else do we have?
Let's see, someone said, do you go on socialsecurity.gov to apply for SSI?
Yes, SSA.gov is the same website, whether you're applying for disability or insurance. And a lot of times when people are applying, like when my son first applied, he didn't know if he had enough work credits. So he said, I'm applying for SSI and Social Security disability, whatever I'm eligible for, give it to me. It's also possible that if you get a small amount of Social Security disability, you could also get some SSI. So you could get both. So one website, one application, one definition of disability, and one standard for mental health conditions. It's all the same, no matter which side of the house you're in.
Okay. And then the question that you were not real clear on before, they have sent me a message clarifying. Basically, right. There is the husband and a disabled 18-year-old with disabilities. They're in the process of changing from student SSI to adult with disabilities. It hasn't been approved yet. And the question is, since her husband is getting SSI and pension, what kind of amount should be coming from his benefits now that the son is 18?
Well, if the husband's getting SSI and not Social Security disability, then there's no benefit for the child. Remember, SSI is a needs-based program. There's no dependent benefits. But if he's actually getting Social Security disability and a pension, he's got the insurance benefit or Social Security retirement, then there would be a childhood disability benefit based off of that.
Great. And then
it doesn't reduce the parent's amount. That's something I didn't say earlier, and I want to be clear. It's not like your kid's getting part of your benefit. You get your full benefit amount, and then they get an additional benefit amount.
Perfect. And then let's see, will the link we receive afterwards have all of these slides on it so we can go to the websites? Yes, your post-event email will include the slides with all of these resources and links so that you can find everything that we went through, since it's so much information that Deborah is going through for us.
I know it's a lot, and that's why I want you guys to have all the tools. So thank you, Katie.
Yes. That is all of the questions in the chat box. Does anyone have anything they'd like to unmute and ask?
I do. My son has been recently diagnosed. He's young. He's like your son, 22, 23, unable to work, severe. I'm not sure if he's going to be able to work again, to tell you honestly. And I'm wondering if I should go ahead and start the process and apply.
Yes, I would always apply sooner rather than later, because
Okay.
remember, depending on what he's eligible for, if it's an insurance benefit, there's a waiting period. And so you want to get that application in. And if it turns out that he's able to work, there are some amazing work incentives, special work rules that allow you to work and keep your benefits and keep your health coverage. And that's actually the next 2 sessions we're going to do this summer are going
Okay.
to cover those rules. So absolutely apply. If he goes back to work, there could be an amazing safety net that's out there to help him.
Okay, because he's been hospitalized quite a few times, and yeah, I just wasn't sure. So just go through go through the Social Security. I'm not even sure, but I'll figure it out. Thank you so
There was
much,
a-
Horton. Oh, go ahead.
No problem. There's a link in the slides to how to apply. So if you go to the slide on how to apply for benefits, there's a link there that'll take you right to the page to apply.
Okay,
Okay.
so go ahead and do it. Someone had recommended. I wasn't sure. I just was so new and so, okay. Thank you.
That's exactly why we're doing this. We recognize that, you shouldn't have to have a disability lawyer mom to get your benefits. And I wanted to share this information with other people so that they could make choices that are best for themselves and their families.
Okay, perfect. Thank you so much.
You're welcome.
Yeah, hey, Katie?
Yes.
Yeah, if that checked, I was able to determine that the amount is more than the $700 that you mentioned. So then I'm assuming that she then is under the insurance part as
Yep.
opposed to the
Yep, Social
Medicaid
Security
part.
Disability Insurance side of the
Yeah.
house. Yep.
So then, just so I understand this, so if it's under the insurance, do those same limits apply, meaning the $2,000 a month and
There was no resource limit for the insurance program. So not for Social Security Disability, but if people are on Medicaid, different Medicaid programs have different resource limits.
Okay.
So if that's the case, the stable account might still be a good idea.
yeah, because I think what happens is that while she has more than that, somehow she gets Medicaid
Yes,
also. And so then
there
that-
are, like I said, many Medicaid programs
Okay.
that people have. Yep,
all right, okay.
absolutely.
I was hoping it would be easy, Katie.
And then Susan was typing a question. I think you wanted to unmute and ask your question, Susan.
Yes, can you hear me?
We can.
Yes,
So I totally support my nephew. He's 34 years old. He's undiagnosed mental illness and lots of medical illness, organ transplant, liver failure, blah, blah. I claim him as a dependent because I totally support him. Is there any way that he could benefit from my Social Security as I'm retired, get the child benefit, even though he's not my child? My brother, his father is dead.
there are special rules that cover some grandparents and kinship providers, but you pretty much have to have had the person since they were very, very young. So I don't know what your situation is, but you could certainly talk to Social Security about what the relationship is, and they can let you know whether that's possible. Another option, honestly, is to go ahead and adopt him. Adult adoption is absolutely possible. And if he's your adopted child, he's absolutely entitled to benefits off your record.
Oh,
It's possible in Ohio
Mhm,
to
Yeah.
adopt an adult?
mhm.
Okay, thank you.
You're welcome.
All right. It looks like we don't have any more questions in the chat box. And just
Okay.
regarding that last one of those previous questions where you discussed the next upcoming sessions. So everyone knows I have gone ahead and copied the website in with the information and registration links for those next 2 sessions.
Great. I'm just going to go over these resources and then I'll stop again for questions, but I want to make sure you guys will know what these resources are. So the first one I've given you guys is a local office locator. So just because I live 10 minutes from one Social Security office doesn't mean it's my Social Security office. When I put my zip code into this locator and click on locate, it tells me that I actually have to go to a different Social Security office. So don't presume that just because you live near one that it's yours. And if you go to the wrong office, sometimes they'll go ahead and help you, which is what they should do. But a lot of times they will send you away. The other nice thing about this office locator, it gives you their phone number for that office and their fax number. So if you need to send them anything, you can do it. Also gives you the address. So someday when they reopen, you can actually find the office. I also give you guys the listings for impairments, all impairments. So I recognize that not everybody here may be eligible based on a mental health diagnosis. As you mentioned, there are other people with other types of diagnoses. So I gave you guys the full listings of impairments. So that's the blue book. It covers every health condition and it goes by body system. So there's a section for respiratory illnesses, and there's a section for heart-related conditions and a section for neurological conditions. So you can go through there if you want to look at other health conditions. Gave you guys information on the ticket to work for information and referrals. For people who are already on a Social Security benefit, they can get free help finding employment, getting employment training, support to keep a job, and individualized benefits planning. So I know I said, you guys, I don't want to hear your personal stories, but this is a way to actually get individualized help. And so they look at specifically how somebody's work is going to impact their benefits so they can make informed choices about returning to work or how much they'd like to work. Also giving you guys the Red Book. It is a Social Security publication. It has information about all these work incentives and work tools we're going to talk about in the next couple of sessions, but I gave it to you guys in case you wanted to take a look at it before then. Again, I gave you guys the link for the stable account information because I just cannot tell you how much it's been a game changer for people with disabilities to not have to worry about resource limits. So there's that information again. And then I gave you a few resources for legal help with appeals. So folks can call the Legal Aid Society of Greater Cincinnati, and I've given you the phone number. If you want to look at what types of services they offer, I also gave you their web address. The Cincinnati Bar Association has a lawyer referral service, so I gave you that number too. And if you're in Northern Kentucky, I've given you the information for Legal Aid of the Bluegrass, because I know some of the people who come to my family support group are in Kentucky. And I've given you their website. That's how you apply for help in Northern Kentucky. Any questions about the resources?
I hate to be so thick. What does the Red Book give you, please?
It's information about the special work rules for Social Security. And we'll be going over those. So the next two sessions are coming up, just so you guys know. In the July session, we're going to be talking about the insurance side of the house, the Social Security disability and childhood disability benefit work rules, and exactly what happens when you go to work, and all the special income accounting rules and everything. In August, then we're going to talk about the SSI, the needs-based side of the house. We're going to talk about what happens when you go to work and you're on SSI. And for each of those, I'll talk about the corresponding health insurance. I know that for people living with a mental health diagnosis, if you went to work and lost your ability to buy your medication or go to therapy, that would not last very long. And so I want to make sure that people are not only able to work, but keep the medical coverage that they need. People like my son who are only able to work part-time may not have access to health insurance. That's why he's on Medicaid. So we'll cover all of that in the next two sessions. Please feel free to join us for any of those that you think would be helpful. And now I'm going to pause and do a final questions. Katie, do we have any in the chat box?
We do not, and we actually are just about at time. So I want,
Question.
oh, go ahead.
Just a quick question. It's a little off topic, but Deborah, you mentioned that you facilitate a family support group. I'm new to the area and I'm trying to find one. Can you share which one you facilitate?
Well, NAMI of Southwest Ohio actually offers multiple ones, and where I facilitate depends on where they need me. So
Okay.
I can share the link in the chat.
Thanks, Katie.
For all of the support groups. If you give me just a second, I will get that pulled up.
I've looked at the website. It's just none of them have been meeting in person yet. That's what I was hoping for. So
a couple of them will start meeting in person in July. I know that Knox is going to meet in person in July, and I think at least one other one. Katie, do you know off the top of your head?
I can't specify which are returning in July off the top of my head, but they are delineated on the website. So I know you have been there. So if you go back, it'll tell you which ones are about to come back in person.
Thank you.
Absolutely. So I want to, again, thank you all so much for joining us today and give a huge thank you to Deborah for helping us all better understand the world of Social Security benefits. Registration is open for the next 2 sessions, which will cover each in more detail as Deborah just outlined. I have shared that link in the chat box. And so please register and join us for either or both and share that information with anyone else that you think might benefit from this. And also, you are going to receive a post-event email with these resources we just discussed in the slides and an evaluation about today's session. If you could take just 2 minutes to fill that out, it really helps us to improve our presentations for the future. And so thank you all again for your time today and have a wonderful rest of your day.
Thank
Thanks,
you.
Katie.
Thanks, everyone.
Thank you.